Welcome back. As we earlier said, the WHO have chosen Egypt among 5 different African countries to be producing or using the mRNA technology in the production of the COVID-19 vaccines. And this is a huge step to be taken in confronting the COVID-19 pandemic inside Egypt. And for more discussion on this topic, we're delighted to be having with us Dr. Yassmin Abou Zeid. She's assistant lecturer at the pharmaceutical department at Faculty of Pharmacy, Helwan University. Good morning, Dr. Abou Zeid.
Good morning.
How are you doing today?
Yeah, fine, great.
We need to know if WHO have just last month chosen Egypt among 5 different African countries to receive the mRNA technology needed for vaccine production. Why is this decision considered a huge step forward to Egypt?
Okay, first let me thank you for inviting me to participate in your program. Second, all the people around actually are familiar with COVID-19 pandemic. So you can find at the starting of the pandemic, many people, we lost many people actually due to this contagious virus. And this actually requires development of many vaccines. And you can find that there are many top countries who were actually producing these vaccines. So let's say America, China, and UK. So they are the most common countries were actually concerned with the production of vaccines. And as you know, that Egypt considered as like the top country in African regions. So when they proceeding or when they adopt the strategy to invent or manufacture a certain type of vaccine depending on mRNA technology, it means that they can be like the source for proceeding or distributing this vaccine among other African countries, and we are no more actually waiting in a long queue to get vaccines from other countries abroad. So, of course, it could be considered as like a marvelous step forward to protect our people in Egypt and in Africa from this pandemic.
Right. How would this technology used in the production of Pfizer and BioNTech vaccine help Egypt and other African countries be able to curtail the spread of the COVID-19 inside Africa?
Okay. First, let me give like a brief hint. I'm not gonna go through a lot of slides, which might be complicated, but using an mRNA technology, it depends on production of certain proteins. So later on, when this mRNA included in the body, in the human body, it starts to convert it to certain protein. So which these proteins refer to? If you see the photo of SARS-CoV-2 virus, you can find like an external coat with specific spikes on its surface. So this coat is exactly the protein coat, and this spikes is very important because it actually responsible for the immune reaction with the body, with the human body. So the virus can only infect the cells through these specific spikes on its surface. So the mRNA technology depends on taking the mRNA segment, which actually, when it's inside the human body, it starts to be transferred or form this specific protein, which actually represents these spikes. By this, you can deliver the spikes represented for the virus inside the human body, and by this, you can initiate the immune reaction or boost the immune reaction. And by default, you can introduce, the human body can introduce a lot of antibodies, which actually protect the body against virus infection.
What exactly is the mRNA technology, and how is it different from other technologies, of course, used for production of other jabs?
Okay, mRNA technology is like more or less similar to genetic technology. Okay, it's not like other common strategies. So used for treatment. So it's not like a powder. You can find it or convert it to tablet or capsules or whatever. So it's like more specific and more complicated technology you use to to actually synthesize or produce a specific segment in a biological system like a virus, which is essential to protect the human body against this infection later on. So just to make it simple, let's assume we have like a key unlock theory. So for a key, there is only one key that can open only one lock, right? So it's using an mRNA technique, it's more or less similar. So we use a special segment of mRNA, which actually produces a special segment of protein, which is specific to certain type of the viruses, which is essential to produce certain types of antibodies in the human body to actually interact with this specific virus. And by this, you can protect the human bodies among the world against this virus.
How does it work using vaccines developed using the mRNA technology in the production of those vaccines? Is it fit for everyone, or is it just fit for certain brackets? I mean, what are the conditions of using the vaccines that are produced through the mRNA technology?
Okay, let's make it in a simple way so the people can understand what I'm gonna say. So the virus can infect all the people, right? It's not a specific, or it's not targeting to a certain type of people in the world. So it can affect me, you, or any other human being on the earth, right? So when we develop a vaccine, depending on this mRNA technology, it means that we having more or less like a virus, but it's not infectious, right? So you can decide the symptoms or adverse effect of this produced vaccine later on when you go for a clinical studies, because my body is completely interacting in a different way than your body, than other people as well. But more or less, it can give you like an estimation when you go through a clinical study that this vaccine is promising or not. So if you go through all approved vaccines, which are around 6 or 8 approved vaccines for treatment of SARS-CoV-2, you can find that they have different percentage of treatment, right? Or different percentage of protecting the people against the virus. But it's not true to go through this comparison, because simply, let's say the one which produced by AstraZeneca, if you go through literatures, you can find that it can protect around 70% of people, and let's go for the one produced by China, it can protect around 60% of the people or 55% of the people. But this actually doesn't mean that AstraZeneca is much better than Chinese vaccines, because simply the AstraZeneca actually treated or the clinical trial for AstraZeneca was actually worked in a different population than the other one for China. So in China, it's actually investigated in Chinese paper, and it started to be released in the market at the early stages of COVID-19.
So thank you.
Yeah.
Right. Dr. Yassmin Abou Zeid, Assistant Lecturer at the Pharmaceutical Department at the Faculty of Pharmacy, Helwan University. Would like to thank you so much. You have a good day. And by this, we come to the end of the breakfast show for this morning. And tomorrow morning, another new episode. Until we see you again tomorrow morning, that's a goodbye.